I'm Dr. Raspaldo from Geneva. I practice in Geneva. My background is I'm part of Italian family. I was born in Monaco and I practiced in Cannes for 30 years. I was a chief resident and chef de clinique at the Nice University, and I'm a facial plastic surgeon, means that I'm concentrate on everything about the face and the neck. And today I want to share, thanks to Swiss Medical Gate, and I want to thank all the team for that what is the new trends? And I want to really relax you, because everything we do is very natural. We don't like over-injected, over-operated faces. And that's the new trend and the new technique. So my background, I arrived here to do all this injection and also surgery. But what I want to share first is when you look at someone or a picture or even a landscape, what is interesting is the play with the light and shadow. If you look at this lady, the old lady, hidden, half hidden on the back, this is like the grandmother, the Italian grandmother, who is the boss of the family. But her face is about the ages. She had a sagging of the fat. She had some indentation around the eyes and the temple, and that creates light and shadow. That shows her age, and that shows her, her life. On the right side, you have this beautiful granddaughter with a brunette with beautiful eyes and triangle face. And you see under the eyes, on the temple, around the mouth, and the neck, there is no indentation, no shadow, no sharpness that shows the ages and the problems. So that's we call the seamless transition about the light and shadow, and the C shape around the eyes from the brow to the mid-face to the eyebrows and the temple. So that's a picture I used for years in my course. And one day I was in Cannes just before the film festival, and this lady came to me and signed the magazine, which is a book of Dolce & Gabbana. It was a campaign for Dolce & Gabbana, and the story is that Marpesa, her name, she came to Cannes when she was 50, and I did some injection on her just before the red carpet. So that's the funny story. So all the artists, and especially Harcourt, you know, this famous photographer in Paris, they play with the light and shadow. You see, the light is very bright on the mid-face and the central part, like brow, chin, lips, nose, and mid-face. Laterally is more hidden, more shadow, because Catherine Deneuve in this picture, she's top, but probably she had some indentation here. Also in male, what is interesting, and this is Brian Jones, you know, the Rolling Stone who died in '69. He was depressed. He was probably a little bit drug addict. But this picture is wonderful because you don't see the indentation on his mid-face and all the trouble of his life, but you see the beautiful hair, beautiful eyes, the lips, very attractive. And this is playing with the light and shadow. So what we do when we do injections or surgery, we play with light and shadow. We try to enhance the beautiful part and to hide and to smooth the darkness. So we have different tools, different methods, and two are very complementary. I mean, one is soft, preventive, and progressive, which is aesthetic medicine or the injectables. And one is more radical, more permanent, and more exhaustive, it's the plastic surgery. So let's see what is aesthetic medicine, and then we will see what is plastic surgery, facial plastic surgery, the new trends. Injection is 50% Botox, and then 50% the filler. A filler is a gel, hyaluronic acid, viscoelastic gel, and those gel and Botox are not permanent. They stay about 6 months up to a year. So we can also, the new trends now is to make a nice, beautiful oval mandible and a nose, lip, and what we call the tear trough deformity. So you see this lady had a long time ago a facelift, so ears is attached to the mandible is not defined, and there is a problem here, there is no shadow, and the chin is a little bit too small. When I look at the face, and the lady complained also about the nose is dropped and the angle is very small. And then around the eyes, you have what we call the dark circle or the tear trough, which is the indentation of the eyes. And then the temple is a bit hollow, and she has some expression lines around the eyes and the brow and the glabella. So the project was to make this more attractive by injecting her jawline with the hyaluronic acid, injecting the chin with another hyaluronic acid, and you look at the contour. It's impressive. This is just one session in my office with no downtime. You see the elongation of the chin, elongation of the jawline, and the light and shadow. Also, lifting the tip with the hyaluronic acid, and also treating those dark circles by smoothing this indentation, the hollow eyes. And then by injecting also on the tail of the eyebrows and the temple, some hyaluronic acid to smooth that shape. And last but not least, she also had some Botox on the brows. So summary, nose lift with only hyaluronic acid, you see, injection here and here. Chin injection, jawline, you see how beautiful is the result. And this is a 3D camera I use in my office for every single patient. Everyone who comes has a 3D picture and we can compare. We can also make some simulation. It is a new trend in my practice. You see here, when you remove the color of the skin, you see exactly the soft tissue, the muscles and the bone under the skin. And that's very effective for me. And you see the jawline contouring, creating a new angle of the mandible and creating a new light and shadow projection. You see the Botox also. Botox is not something that your brow doesn't move and does frozen. By the way, I can show you my brow. I have some Botox. I do my Botox every 6 months. I'm 60 years old, I'm very expressive, and I have no wrinkle, but my brow is moving. So you see her, she had some wrinkle on the brow. We did a little bit of Botox, very natural, to smooth the wrinkle. Okay, and the complete treatment, the before and after, and this is just a week after Botox, hyaluronic acid, hyaluronic acid, hyaluronic acid also on the lips, on the nose, on the chin and the mandible. And you see how attractive this lady is after one session. I describe also another technique, which is the chic lift, which is injecting the hyaluronic acid under the eyes because of the indentation, elongation of the lower eyelid, because of the sagging of the fat. So that makes the eyes very sad. With one syringe of hyaluronic acid, you can see here the injection point, and this is immediately after. You see there is no good. You can make this more convex and shorten the lower eyelid, playing with light and shadow, creating the illusion that she had a better lower eyelid and a better look. And you see the brow, temple, eyebrows, and mid-face are smooth, and that creates a C shape that I call the chic lift, only with injectables. Also, I know we are with the Chinese people, I hope so. So I also do some injection of Asian faces. So this one, she's a Thai lady, but just to show that we can do the chic lift under the eyes and the temple and the eyebrows on the Asian population. The nose lift, of course, more injection of the bridge of the nose, and chin injection to make this face more balanced. Again, to play with the light and shadow. And this is very effective also on Chinese or Asian faces. So that was injection. Now we go down to facial plastic surgery, nose. So I like the nose because it's very effective. And I like the scarless rhinoplastie. It means we don't do any scar. It's no downtime except 1 week. Then we're going to see the ear folds, which is a technique for ear pinning just with a clip with no downtime, the same. Also, when you have an elongation of the lip, upper lip, you can do a lip lift, removing some skin on local anesthesia to make the lips more attractive. Nowadays, on the young population, the bichectomy, which is removing the fat from inside the mouth to recreate a hollowness on the cheeks. And that's very popular on the new generation because of the star of the top model, etc. Eyelid surgery, we do it on local anesthesia. That is something new. Facelift, I like to do the endoscopic brow lift and facelift. It's very natural and no downtime except 2 weeks. And then we're going to see chin and jawline surgery with the implants on the hospital. And then a little bit of words about nano-fat lipofilling, which is using the fat to make the skin more attractive and to fill the gap under the eyes and the cheeks. And then the words about the suspension threads, which is a local anesthesia to lift a little bit the cheeks and the mid-face and the neck. And then how we have a new eyes on reconstruction, on facial reconstruction, because we are more creative and we don't want just to reconstruct the face, we want the face, make the face more attractive. So first example about the nose. Here, the top model, you see the hump of the nose, a bit masculine. So what I did, the rhinoplastie, surgical rhinoplastie from inside, all incision is in the nostril, no downtime except 6 days. The nasal sprint is just for 6 days, no pain, and of course, no dressing, nothing. It's very natural, and that's the top model I use to illustrate. So this is the same. She's a French top model. You see the nose is very delicate, and she had no downtime except one week, and it's day hospital, ambulatory. Another lady with a hump of the nose and with a delicate scarless rhinoplasty conservative incision into the nose. You see how you can make this profile very attractive, and also the 3/4 view. So what I like is there's something natural with no downtime, not a lot of aggression, and not a big trauma operation like we see sometimes, even nowadays. So nose has to be subtle and very, very natural, and of course ambulatory. Sometimes the nose is broken, or the reparation of the nose is not so good. So this lady had I did an operation on her. I did a little bit of cartilage graft, and you see how you can make her face more attractive just because of two small grafts of cartilage in the nose with no scar. Again, it's a scarless rhinoplasty. And we remove the cartilage broken and the bone to have a very beautiful and attractive contour on the profile. The nose has been very popular for 50 years because of surgery, but nowadays what is very popular is what we call the medical rhinoplasty, and this is called nose injection. So if you want to Google my name, Raspaldo, and the title Eiffel Tower Nose Lift on PRS Global Open, which is a very important scientific magazine, which is the top one for us plastic surgeons, you can see the article and 4 videos about this concept of nose injections. So it's a concept of the Eiffel Tower, because the Eiffel Tower, first you have to build the footage. The footage is what we call the nasal spine to support the tip of the nose. Then we inject on the support, the columella of the nose, and then on the tip of the nose. So you can do step 1, step 2, and step 3, but sometime on the step 1. And that's great because you see on, for example, she's Korean, on Asian noses, you can change the dorsum and the nasolabial angle by lifting this tip. You see the tip projection because of injection on nasolabial angle, and also the dorsum. So that's the shape of the Eiffel Tower, and also the dorsum of the nose. So you make the nose more structured, and the nasofrontal angle is higher. So the face is suddenly more attractive. And this is 30 minutes with the hyaluronic acid. And that stays about a year, sometimes more like a year. You see the building the
Dr. Raspaldo, Dr. Raspaldo, can you hear me?
First, we do it on Caucasian faces. She's Australian. She had a little bit of a hump. She didn't want to have a rhinoplasty, so we injected half a syringe on the tip of the nose and half a syringe on the bridge, and that's the result. What is new on ears? When you have big ears like this, even if you're a star like this guy that everybody knows, he has a very attractive but a bit of funny face because of the ears. And this is a picture taken from internet. Of course, he's not my patient. I would be proud and happy to have him as a patient, but he had an otoplasty, ear pinning, and you see the oblique and funny ears there now are very vertical, and now you look more on his face than on the ears. And that's the trick. So instead of a big operation, we can use this clip, and this is from an American company, but the concept was created by my friend, Dr. Qu'on from London. I want to thank him. He's a very great ENT surgeon. He created this clip that you can use on local anesthesia, so you can try it before. It's a tungsten metal covered by gold, and the clip then is fixed on the cartilage under the skin. So we have one beautiful lady from Geneva, and she's very happy to accept to show her pictures. And this is a drawing, and where we put the clip. So we do it in local anesthesia, in a clinic, but local anesthesia. That's her with a pre-clip, and that's her with the final result. You see the clip is under the skin and not so visible, with a very natural contour. And that takes 5 minutes per ears, 15 minutes totally. So it's very effective. And that's her before. You see the oblique of the ears, and now it's more straight. And we can use it also on a lady a little bit older. She's 30 and she's also from Geneva. You see the ears are very weird. And after this clip, one clip per side, look at the wonderful result. Also, she's very, very attractive. And if you look carefully, look at the lips, that's a transition to talk a little bit about lip injection. So the new trends are now to do a lot of big lips. I don't like big lips. But nowadays, all these young people, because of the selfies, because of Instagram, because of the trends, they like to have more plumpy lips. So in a case like that, I would say that 15 years ago, 10, 20 years ago, we would not accept to do the injection. But nowadays, with the new hyaluronic acid, very soft, very elastic, I accepted to do that because her face, she's tall, she's very attractive, she has big eyes and big cheeks. So a little bit of lips, more glamorous, fits to her face, okay? And that lasts from 8 months to a year, okay? When the lips is very long and you cannot use a lot of injectable of hyaluronic acid, what you can do, you can remove some skin under the nostril and the nose, and that is called a lip lift. So it's more for the older patients, and you remove this piece of skin, sorry for the people who are not doctors, but we remove this kind of W or M shape, butterfly shape is better. And you see the scar is under the nose and then you don't see it. Local anesthesia, done on local anesthesia. And you see here the before elongation of the upper lip and the after, and this is 6 days after her lip lift, but also her nose, her endoscopic brow lid, and fat grafting under the eyes. And you see that she doesn't have a lot of downtime, and she's very happy with this combination of treatment, especially the lip lift. One of the most popular operations nowadays is what we call the bichectomy. Bichectomy is removing the fat pad from inside the mouth to create from the convexity and the light projection of the cheekbones and the other projection of the mandible, some shadow. And you see that you play ladies with the makeup to make something brown or dark to create this hollow. So that's a top model from Switzerland who showed her face, and the photographer created the illusion of a shadow on her face because he put the light and the air to create this shadow. So the concept is to removing this buccal fat pad, this bichia fat pad. This fat helps to slide when you open and close your mouth. The mandible slide on the temporal fossa. So what we do, we remove on local anesthesia this part of the buccal fat pad, and that helps to create the hollow. So it's a local anesthesia into the mouth, like the dentist, and then you can remove 10%, 20%, 50%, up to 60 or 70% of the fat pad. And that creates, and that's the same top model before with the light on the mid-face and shadow on the cheeks. And this is after, and this is natural. You see, it's a natural indentation on the cheeks here. And I'm proud to show you another lady. She's from India, and I did her bichectomy and a little bit of her nose. And she had a lot of role, like the chubby face, the petite, beautiful girl. And she wanted to do more sexy and more female, more feminized. And now she can play more role in Bollywood with this triangle face and some shadow on the mid face here. And that's why the young people, they like it. And there is nothing you can do because liposuction doesn't work. It's really the fat inside the mouth. For the eyelid, it's something we do for ages, but what I recommend is to remove that skin and to create a parallel arch from the eyelashes to the eyebrows to the upper eyelid. And you see that parallel line was broken because of the skin excess. So the new trend is more you do it quickly, earlier in life, around 40s, when it's necessary sometime earlier, then you remove the skin, and by removing this skin and a little bit of fat, you don't need to wait, and then the scar is not that long and visible, but here you see it's almost invisible. And this we're going to do it on local anesthesia. The other trend is the eye bags. Eye bags, you don't need to open the eyes. You go to cut the eyes and the skin. We go from inside, we remove this fat hernia, and this is the result. Again, local anesthesia and day hospital, and no downtime except 1 week. And this is when we combine the upper eyelid surgery and the lower eyelid surgery. And this lady, she's 60, and look at the change on her eyes. Of course, you can also combine with some light chemical peel and some Botox on the brow, and that's the result of this 55-year-old lady before and after. So the facelift is something really new nowadays because the endoscopic brow lift, and also thanks to the analysis with the 3D camera, the photo consultation with the 3D camera, and that's the photo camera where we remove the color of the skin. You can see the sagging of the fat, the indentation on the mid-face, and the sagging on the fat here. So what we do, thanks to the 3D camera, I can explain to the patient where we can act here, liposuction here, mid-face left. And this is a result on the same kind of lady, 60 years old, liposuction of the neck and the jawline, and face left with incision into the ears, not so visible, and very natural result. The facelift has to be natural. That's not has to be visible, it has to be very natural. And thanks to the video camera, we reduce the length of the scar. And this is a lady, or 50 years old, very active businesswoman. So she wanted to do her oval. So that's we call a mini lift. So it's just under from here to here. This is a scar after 1 month. So we did also her upper eyelid, a mid-face injection with nanofat, some fat grafting, and the beautiful facelift, the mini lift. And you see the chin and the neck beautification. And I show you what we can do with a 3D, the before and after. And there's no comments about the before and after. You see the beautification of the neck, the cheeks, the cheekbones, and the scar after 1 year is not so visible. It's important to hide it into the ears and to make as discreet as possible. You see how delicate and attractive is the face because of the creativity of this technique and the mini lift and the endoscopy. Also on male, we have more and more male, thanks to the Zoom boom, thanks to that people wants to be more attractive even when you're 70 or 60. And this one guy he's 65, he's a friend of mine, orthopedic surgeon. So I did a liposuction and the lift, facelift. See the scar, this is after a month, into the ears, is not so visible, and he's more natural and attractive. I have 2 last slides to finish. The chin also, we can change the position of the chin with a chin implant. So the new technique is on local anesthesia through the mouth with no scar. You can elongate the chin, and you can combine this chin elongation with the nose, with a rhinoplastie. And then you can change completely the profile and change the life of people and make them more attractive and not completely different or too visible. A few words about the threads. The threads are resorbable threads with they are barbed and they pull the skin, the muscle, and the fat. So I don't like to use permanent threads because I want something resorbable. And this is the result in my office with 2 and 2, 4 threads per side just to pull the muscle and the skin and the fat to get this result in a couple of minutes, like 30 minutes. And that stays about a year. So it's the step before going for surgery or something you can do if you don't have a lot of fat or too much sagging. It's a great technique. The last is very interesting because I remember you had a course, a beautiful webinar I showed by my great colleague, the plastic surgeon, and Dr. Salomon, dermatologist, about reconstruction. So nowadays, reconstruction is not only reconstruction. This lady had a trauma on the chin, burn on the face. We did a chin implant, liposuction, and facelift. And this is her result of a combination of all those techniques. It's not only reconstruction, it's also beautification. So we think about the eyes with the eyes of a plastic surgeon or aesthetic surgeon to repair the face, not only to repair the chin or the skin, but also to recreate this elegant neck and jawline and cheeks with this facelift and chin implant. And also when I do a reconstruction, that was a case I did in Cannes when I was in my practice there. When you have melanoma, which is a malignant tumor, a black one, you have to remove 2 centimeters around the tumor. So I don't show you because it's not so pleasant for non-surgeons. So we remove all that. Then we did a cut here and we repair, and this is the result. And quickly, I show you that's the reconstruction and the scar, and this is after, and this is the result. So you see how beautiful is the result. It's not only a reconstruction, it's also beautification of the face, even after a drama or trauma. So to conclude, we have to think about light, we have to think about curves, we have to think about shadows. And I like this advertising because they put the picture and the painting on the cheeks and the hollow and the shadow there. And this term of the artist is what we are. We are doctors, we are scientists, we are very high-level technician, but we are also artists, the plastic surgeon. And the shape of the face, all the contour is very important. So remember, we can do aesthetic injection. This is just a Botox to relax the muscle in the midline here. Jawline, mid-face, tear trough, all this is hyaluronic acid. This is aesthetic medicine. We can do it in the office, with no downtime, no pain, not a lot of bruises. And then all the lists of what we can do with facial plastic surgery. And this is one of my other model. I did her nose and a little bit of injection under the eyes. So to summarize, there is a lot of new trends in facial plastic surgery. I am a specialist of only facial plastic surgery. I don't do breasts, I don't do body, I don't do liposuction. So I'm in excellence in facial plastic surgery and injectables. So also the purpose of this course was to show you that in Geneva, we have a high quality of service for medicine. And it's true that nowadays it's better to choose your surgeon and your doctor rather than a clinic, because the clinic, you can have a great clinic, but what is important is the skills and how you can be treated. Of course, we need a beautiful clinic, and Swiss Medical Gate are the best option and the best partner to help the patient to come in Switzerland to be treated the best way, and also for the accommodation, all the paper, and nowadays with the COVID, we know we need a lot of help.